The following program is a production of WXCL Television.
Good evening and welcome to a special edition of South Florida Today called Critical Condition Healthcare Prescription. In our country, 47 million people are uninsured. 8 out of 10 of those come from working families. And contrary to what many believe, 78% of those without health insurance are American citizens. Here in Palm Beach County, it's estimated 150,000 go every day without coverage. And most of those have not been able to see a doctor for more than a year. Tonight, we are bringing you this special in conjunction with an upcoming national POV documentary. It takes you inside a diverse group of uninsured Americans as they battle critical illness over a 2-year period. It is also called Critical Condition and will air right here on WXCL TV on Tuesday, September 30th at 9 p.m. Here's a bit of that show.
Given the $2 trillion that we spend on healthcare in this country, that's enough money to care for everyone.
We're the only major industrialized nation that doesn't have a national health care.
It makes no sense. Does that mean if you get sick in this country, we should just take you out in the backyard and shoot you because it's cheaper?
This is crazy. We have the best science, but we don't have the best healthcare system in the world.
It shouldn't matter whether you got a $20,000 a year job. Your life is just as important as somebody else's that makes a lot of money.
Now, while the POV documentary outlines the issues facing those without insurance, here at South Florida Today, we wanted to go beyond the problem into solutions in our area. And we found some very valid programs offering help. First tonight, we travel to one of several health department clinics that every day reach out to those who have nowhere else to turn.
If you just look around and you see the number of patients that we have here, I'd say a year ago we had a little bit of a decrease, but over the past 6 months to a few months, we've had a drastic increase in the number of patients coming that have been losing their jobs that as a result have lost their insurance. But we've seen a very big increase in our numbers.
Dr. Zito says thousands of patients a day come through the doors at the 45th Street Clinic. Some are very sick. Others just need the basics.
We do everything from just a healthy, well child physical, like in pediatrics, we do a lot of well childs. In our adult medical clinic, we do everything from a physical for a healthy 20-year-old, but we also do, we see a lot of chronic disease. We have a lot of hypertensives that are out of control, a lot of diabetics, a lot of heart disease. So we do, you name it, everything.
It was a problem because of the insurance, the share of cost.
That's the reality of things. And more people, believe it or not, most of them that are working now are unable to afford insurance.
Yannick Gripkov is the nursing director here. She says the numbers have risen dramatically in the last 6 months. So much so that those who work inside this clinic are heading out to the streets and shelters like Cafe Joshua. The aim is to try and offer those without hope a little bit of help.
As you get your insurance, we make you an appointment at the clinic for a complete checkup.
Almost like a third world, right here in West Palm.
You go to a regular physician?
Joining me now is Dr. Alina Alonso, Assistant Director of the Palm Beach County Health Department, and Paul Gianfrido, President of the Quantum Foundation. Welcome to you both.
Thank you.
Dr. Alonso, in that brief segment, we saw and heard about the health care offered. This is unique pretty much throughout the country that these health departments that you run can offer that kind of care.
Yes, and we've been doing that for over 50 years, so we were definitely ahead of the curve in Palm Beach County. We've always wanted to take care of our own here in Palm Beach County, and we do that with the help foundations such as Paul's and the Healthcare District.
And Paul, your foundation dedicated to healthcare in Palm Beach County, keeping everyone healthy. Why, if I have my insurance and I pay for my insurance, do I care that other people don't?
Well, it seems to me that if you don't care, then you're going to be in trouble down the road, because people who are uninsured still need care, and somebody has to pay for that care. And the way we pay for that, if we're insured, is through our health insurance. That's why our health insurance premiums in Florida are outrageously high. People can't afford health insurance because so much of this cost has to be borne by people who are insured. What we need to do is engage in solutions where the government and the private sector work together, not opposed to each other, as we do in Palm Beach County, to try to get everybody good access to quality health care.
Why do you think, because the Point of View documentary points out so many problems, why does it work with the private sector foundations such as yours and public health departments and the health care district? Why does it work so well here in Palm Beach County, in both of your opinions?
Well, I think we've had some very dedicated people with vision that have sought this problem. I mean, it's a problem that's existed all along. I think we're seeing it worsening because of the situation, the economic situations. But we've had these economic situations in the past. We work together as partners. We've developed these relationships through the years. And from the very beginning, one of the reasons that we don't have a city hospital, for example, in Palm Beach County, because that decision was made that we would work with the private sector and the government working together, not against each other.
Paul, over and over again, we went all over the county to clinics, to different entities, and we heard that the need is so outstanding, especially in the last 6 months. Do you feel that at the foundation, where I know, grantees come to you every day begging for dollars, literally? Do you feel that when you're being asked for more and more dollars to help these people?
Oh, we absolutely feel that. The reality is that we're doing great things in Palm Beach County. Our foundation, in partnership with other foundations, the terrific health department that we've got that Alina and others are responsible for, the private sector, the free clinics and others, everybody here is doing all they can do to address this problem. But way beyond anything we can do locally is the factor of 10 probably that we need to have done for us, that we need the state and the federal government to partner with us to do. I think the real solution down the road is for the federal government and the state government to play bigger roles in making sure that they support the kinds of efforts that we're engaged in here in Palm Beach County, and not leave it just to the local taxpayer and the local philanthropic community to do this. We can't.
And in your opinion, why doesn't Washington get that? Why they look at all the other countries where we spend 50% more in the U.S. on healthcare than any other country, yet we're the #1 country in the world. Why don't they get that?
Well, it's because we don't have a focus on prevention, which is our strategic plan. We spend thousands and thousands of dollars treating diabetes, but we do nothing about obesity. We do nothing about nutrition. So until this country makes that switch to think about prevention, we're not going to get there.
A lot of people say, when prevention succeeds, nothing happens. And our government seems to enjoy crises and crisis management, and that's when our government often can mobilize to address problems. Well, as Alina says, if you invest instead on the front end of prevention, you can affect positively about 50 to 75% of health conditions if you put the money in on the prevention side, yet only 3% of our national resources go to prevention. It's just insane.
It's just insane. And in other countries, they could never even imagine that. Prevention is the cure, literally.